Welcome back. 52% of Americans report they feel some level of loneliness. We see loneliness as an emotional issue, but experts say it's much more than that. Mental health takes a serious toll as we experience loneliness. Since February is Loneliness Awareness Month, and we have program specialist Janet Miller joining us now from the Idaho Commission on Aging. First of all, Janet, thank you so much for joining us here today.
Thank you so much for having me.
Yeah, so, we usually think of loneliness as being an emotional issue, but that's not always the case, right? Can you talk a little bit about that?
So experts have researched, and they've discovered that loneliness is equivalent to smoking 15 cigarettes a day, or having a sedentary lifestyle or being obese. But so the results of loneliness are that there's an increased risk of heart disease and stroke, and 50% increase in your risk of dementia.
Wow, 15 cigarettes a day. That's startling.
Absolutely.
How is loneliness connected to mental health?
Well, obviously mental health, it's a mental issue. And so when we research loneliness or social isolation, we see that there's an increased risk of depression and anxiety. And of course, suicide rates also jump up when people are lonely.
Does it vary depending on age group?
It does. So the effects are the same. But what was really interesting to me, I started researching loneliness because I work for the Idaho Commission on Aging. And initially I felt like the seniors were going to have the highest rate of loneliness. But when I did my research, it's actually young adults that have the highest rate of loneliness. And that was very personal to me because my children are young adults. And so it has a huge impact on me personally.
And you were saying actually, as a personal story, you were directly impacted by this as you were doing your research.
Absolutely. So I was working, when I started this job, it was mid-pandemic, and I started doing research on loneliness just because I wanted to have an impact on loneliness for seniors. And I was all alone at home researching loneliness, and it just made me feel that much more lonely, and it made me look for solutions to the loneliness epidemic.
And speaking of those solutions, what can folks do to prevent this from happening to them?
Well, the biggest thing is reach out to people. The thing about the pandemic, prior to the pandemic, we all had our own, loneliness experience. But since the pandemic, we've all had a similar experience. We all went through loneliness. We all were alone. We were all looking for someplace. So reach out to your friends. I called a friend that I hadn't talked to in years, and we started making a regular dinner date just to alleviate the loneliness. And the other thing is to admit your loneliness. We don't necessarily want to admit that, but remember, everyone around you is going through the same thing.
Yeah, I think a lot of people saw it, especially during the pandemic, as you mentioned. What do you want folks to know who might be watching right now?
I just really want them to know that it's okay to say you're lonely, and mentioning you're lonely, people are going to reach out to you. I can guarantee you, when I've mentioned that I'm lonely, my friends have reached out to me. Or when I'm saying, if you're lonely, reach out to me, let's talk. And sometimes it's just a phone call or a dinner out. It doesn't take a lot, but make an effort, take care of your friends and neighbors, and they'll take care of you.
A lot of good advice there. All right, Janet Miller, thank you so much for joining us here on the News at 4. And